ways hard to understand risks. So we're very grateful to all the storytellers, the filmmakers, the writers, the journalists who are helping us understand this and expediting change in this very crucial situation. Let's go, I guess, on to our first clip, and then we'll open up a discussion.
Sorry about that. Here we go.
As millions of Americans were sheltering in place over the past months, we began looking at the toll the coronavirus was taking on those who cannot stay home. Agricultural workers, many of them undocumented, who were deemed essential to the nation's food supply. I've been reporting in this community for years, and as the annual harvest was starting in California this spring, I was hearing from workers who were daily having to choose between their jobs and their health.
Todos los campesinos estamos haciendo un sacrificio grande por necesidad. Sobre todo es por necesidad, por hambre, por ver a nuestra familia comer y por tener donde vivir.
Cynthia Hernandez is one of the few workers out of dozens we spoke to who agreed to go on camera. She's a broccoli picker in the Salinas Valley, a region in California that produces most of the country's leafy greens. In addition to having cancer, Cynthia has diabetes, both of which put her at high risk for complications if she contracts COVID-19.
No nos están dando lo esencial para protegernos.
She works for a contractor that supplies workers to farms in the area. She told me she's expected to bring her own mask to work.
Nosotros que estamos trabajando y tenemos tantas deudas y cuentas que pagar, el dinero a veces no nos alcanza ni para comprar una sola mascarilla, que en la tienda no lo dan. Una sola mascarilla, $3, $4. Y es desechable.
When we met Cynthia in April, there were no required COVID protections for farm workers, beyond general rules about masks and social distancing. Even now, companies don't have to tell workers about outbreaks.
Quiero tomarme hasta un ibuprofeno. Me duele mi garganta.
If one farm worker gets sick, you're going to get a crew, which is typically 30 people, sick. And if each of those people goes out, they're going to get 3 to 4 other people, because that's the infection rate. And so the thing snowballs.
Good morning.
Dr. Max Cuevas runs a network of clinics in the Salinas Valley that primarily serves farm workers.
And so with my staff, I told them we need to plan with whatever little resources we have. We need to plan to make sure those resources are in fact available. So we thought, let's jump in. Let's begin making masks.
Just before dawn, Dr. Cuevas' team was meeting workers as they caught rides to the fields.
Buenos días. Somos de la Clínica de Salud. Estamos regalando máscaras. ¿Le gustaría? Okay. ¿Va a venir más gente? Somos de la Clínica de Salud. Estamos dando máscaras. ¿Le gustaría una? ¿Listas máscaras? Estamos regalando máscaras. Una para ti, una para ti. Máscaras. ¿Quieren máscara?
When our state and federal governments announced that the farm worker was a part of the essential workforce, included with healthcare, first responders, police, it's not your middle class essential worker that people are talking about. This essential worker a lot of them do in fact live in fear. They don't want people to know that they're here undocumented. There's that fear of, I could be gone tomorrow if I'm taken away, and what's going to happen to my family. It's a horrible kind of fear that people learn to live with. You try to assure them that don't be afraid of that one right now. Be afraid of the virus.
Thank you so much, and welcome everyone who's just joining us. We're so pleased to have you here. Again, this is a co-sponsored presentation between the Berkeley Food Institute and the Office of Assemblyman Robert Rivas. We're so honored to have the two filmmakers of the short clip you just saw, COVID's Hidden Toll, with us today. We have Daffodil Altan, producer and correspondent for Frontline PBS, and Andres Cediel, a professor at UC Berkeley Graduate School of Journalism. Thank you both so much for taking the time to join us.
Thank you.
Yeah, well, as we jump into this content, and we'll be seeing another clip in about 20 minutes more of the movie, and I just want to tell everyone that the film is available streaming for free on PBS Frontline website. It's about an hour long total, if I think that's right, and it's really powerful and important viewing, so I recommend everyone to look at the full thing when you have time. But I wanted to ask you both about your experience making this film and also your history in this community. I can tell that you both have a lot of inroads and relationships, and can you tell either of you tell us about your experience working in this community?
Yeah, I'll go first and I'll hand it off to Daffodil. I mean, this was, and thank you for having us. This was in some ways culmination of almost a decade's worth of work working in the reporting on the agricultural community. Our previous work highlighted abuses of immigrant women in the fields. And then we did a piece about 2 years ago about underage minors who were trafficked in the agricultural industry. So this was a community that we had been reporting on for a while. There's a lot of challenges reporting in this community because folks are undocumented, because they're so vulnerable. And so when the pandemic broke out and we were trying to figure out how to do some important reporting, we went back to some of our original sources in Salinas and started getting there on the ground. This was back in March. This was right when things were beginning to happen, to find out how this community was dealing with the pandemic. What were the regulations that were in place or not in place? What were the struggles that people were having? So we tapped into a lot of the knowledge that we had previously to put into this work. And Daffodil, I don't know if you want to add more to that.
Yeah. I mean, it was, I think one of the first questions that came to mind when this was early in the pandemic, it feels like we've been in this for so long now, but back in March, it was like everything shut down. California was the first state to go into shelter in place. And so really what everyone was doing who didn't have to work, was at home trying to figure out, do they have enough toilet paper and food? And so when everything was stripped away in that way, when we were having conversations at Frontline and between us, Andres and I and together talk, and it almost immediately was like, wait, what about the food, and what about the farm workers, and what's going to happen to them since they have been deemed essential, but they're still in this very precarious situation where so many of them are undocumented and targeted and criminalized. How are those two realities going to intersect as this pandemic unfolds, and as what we know is going to happen is that people are going to begin to get infected in large numbers. So we said we need to start documenting this somehow, even though it's early. This is, what we were hearing from our sources was this is just waiting to happen. This isn't something that can be stopped in terms of infection among workers. And here are the gaps that are still present that are going to lead to rates of infection that might be very high among farm workers and agricultural workers. So that's what got us started.
And how did that play out in the field? Oh, sorry, go ahead.
No, all I was going to add was that at that time there was no data. People didn't know what was happening yet. All the conditions were there to see this problem happening, but people hadn't been collecting data. Within the time period that we were reporting, we started to see numbers that COVID was more prevalent within the Latino community, like broadly speaking. So I was like, okay, we can definitely see that. And then towards the tail end of our reporting, this aired in July, numbers were finally starting to come out about how this was affecting the farm worker community specifically. And it was much higher rates of infection, and it continues to be so. But I think you're going to ask, being on the field, ask that question.
How did it play out on in the ground, both with workers and the companies they worked at, to have undocumented status and essential status? Those are both just words, but what did they mean for people's lives?
Yeah, I'm glad you highlighted that, because I think that was some of the driving, that was some of the motivation for why we wanted to capture the tension in this story, is that you're deemed essential, suddenly you're deemed critical, like we in the line there, that's straight out of government language. You're critical to the nation's food supply. So it's like you're given this very important designation, but at the same time, you don't have, if you're undocumented, which estimates range anywhere from 60 to 85% of ag workers are undocumented. So if you're undocumented, you're also at the same time being denied a stimulus check. A lot of what we heard was there was already food insecurity among the agricultural worker population. So you're producing food, you're critical to the nation's food supply, but you can't even receive stimulus money to provide food for your own family. So this tension, this overlap, you're critical to the nation's food supply, but you're afraid to go to the doctor potentially because of your status and because of the last 4 years of President Trump and all the various policies that very specifically were targeting undocumented immigrants. So emotionally, the challenge was, I need to go out to work to feed my family. I'm being deemed and given this letter that classifies me as an essential worker, but I still don't have masks at work potentially. It was very uneven, and there were companies that did provide for their employees. But Cynthia, who you meet in the beginning of the film, worked for a contractor who in the beginning wasn't providing anything for them. So, over and over again, either overtly or subtly in the film, you see how that tension of being both so important and so critical, and also being afraid to even seek the most basic services, is just completely at odds. And the results are what lead to the data that we later got for, that you later learn in the film, that the infection rates are going to be higher.
So in reality, essential just meant you must come to work and here's some clapping. I mean, there were no benefits provided, special benefits due to the critical worker status.
Oh, go ahead.
Well, I was just going to say, and that's also part of the dilemma that these people were facing, is because people needed to work.
Mm-hmm.
People needed to work because they needed to be able to have an income. And this is part of the terrible contradictions that all essential workers have during this pandemic. But this population is even more on the margins. So this is this terrible contradiction of, I need to go to work, but if I go to work, I might get sick. If I get sick, I don't want to go to the doctor because of the public charge rule that this might hurt me later. So it's a terrible predicament that people were in.
Mm-hmm. What most surprised you making this film?
I think one of the first things, what was different about this for me personally, having been out in the field on multiple occasions, we travel, we go out, we interview, we spend time with the subjects in the film. And, the first time I left my house to go shoot for this film, I was interacting with workers who'd been working nonstop. They never had the opportunity to shelter in place. So I was leaving a very sheltered situation. I was nervous, I was afraid. And the first interviews we had, the first conversation we had, it was 3 workers who had just the day before come out of isolation. So they had all tested positive. They had all been isolated in one room in their family's home, while they had elders living with them, they had children living with them, and they were young in their early 20s and still didn't necessarily look well, but they'd been cleared to go back to work. So they were about to go back to work within the next day or two. And that was our first interview. And I just remember the shock of having COVID suddenly feel very real and very present. And also something that we were all sharing in. So normally, often we're reporting on something that's happening that someone else is happening outside of my own experience. But this time, every time we interacted with subjects in the field and with the characters and the people that you get to meet, Cynthia especially, and it was COVID was all around us. And I think that for me was surprising and different, that we were all worried all the time, that we were all trying to figure out how to be around each other, not knowing, am I safe for you? Are you safe for me? Can we tell a story? But also we were engaging in a different way because we were all talking about how this was making us feel, how we were worried, how we had family members who were elders. So it made for a different kind of visceral conversation because we were all living through the moment at the same time. That was very different. I don't think I've ever had that experience where we're all collectively going through something, and yet I had the opportunity to then leave the field and go back and quarantine and go back in shelter. And what was constantly present in my mind is all the people we were just with they have to keep going to work, and they don't have basic protections at work to keep them from getting COVID-19.
Yeah, and I was going to say, based on that following up in the end, what surprised me is that there was no mandated protections for anybody, right? We were looking specifically at the farm workers, and there were voluntary guidelines, definitely in Monterey County, but in some other places. But it turned out it was voluntary for everybody, that there was no guideline, because working at UC Berkeley, we were comparing, what would happen if there was an outbreak on the farm, and, the workers were saying, how come nobody told us? At the same time that I'm getting an email from UC Berkeley saying, we understand if there's an outbreak that you would like to know, but we're not going to tell you, right? So it was like, it turned out that there was no guidelines for anybody that people had to do about what it meant to be safe at work. So that was really a surprising aspect.
And what you had to disclose, that, both disclose to your employees, how you had to manage. We thought initially in our reporting, surely Cal OSHA has, surely there's something that employers have to do. And then we looked and there was nothing that was mandatory. Then we thought, surely federally there's something that employers have to do, and there was nothing at the federal level. And then you start looking at different states, and there was just nothing until eventually one state passed mandatory emergency workplace safety standards. And when I first started talking with Assemblymember Rivas, who's also in the film, and I was just, making new contacts and sources, that was one of the things we talked about, is just, wait, hold on. And he was like, I know this is something that I've been wanting to, legislation that I've been looking at, and I've needed to, this is a real issue, that we have nothing that's mandated right now for these workers.
Our American individualism, our ethos of individualism is really being tested, isn't it? Especially when it comes to data or how we all understand information or are responsible for what you pointed out. Such a good point, our collective experience, in certain ways, our collective experience. Now, you brought up emergency COVID safety rules, and I'm reading some of them, the Cal OSHA rules, some of them which just came into place recently, and when it remains to be seen whether they're going to be codified long-term by the state legislature. They include such pointers as workers must be separated by at least 6 feet unless employer can demonstrate it isn't possible. Employers must keep paying workers if they contract the virus at the workplace. Sort of hard to prove that. Positive workers must not return to work until after the 10-day quarantine and at least a day since 100.4 plus fever has resolved. Those are just a few of them. Do either of you want to comment on if this is progress or how you see this playing out for some of the subjects in your phone?
I think it's definitely progress in the sense that there's something universal now that every employer, whether you're a state employer or a private employer, has to follow. Because what was happening was, when you had the guidelines, they're voluntary. So you had some employers that were following every guideline, and we encountered some of them in Monterey. There were large, farmers that were actually giving masks and providing, housing, et cetera. But then you could go to the contractor next door who wasn't doing anything, and you had no way to check, enforce, follow up, because there was nothing that they had to adhere to. The only thing that they had to do as employers was submit their plan for what they were going to do in case of infection or outbreak, or what they were going to implement. But even that, it's not like that was going around being enforced. So I think there are still gaps and there's still going to be problems, but at least there's a universal standard that every employer has to follow. My brother-in-law, who's a police officer, that's a state agency, county agency, they had a mask optional at work, and he just recovered from COVID-19. He finally got it, and he was worried all the time because there was no mandate that his employer had to follow. So I think it is progress in that there is something universal that you can say, here are the rules. You can post it at work. Employees can know this is what's supposed to happen at the work site, because we had in the film, you see a situation with a different worker where there's a potential infection. They want to go home. They don't know if it's safe. And, this isn't in the film, but the woman who's anonymous, who tells her story, said she called Cal OSHA, and they said, well, if you have masks, there's not much we can do. And whereas now, I think if there's a set of standards that employees know their employer must follow, and they see that there's a gap there, at least there's recourse.
Yeah. And of course, the science, what we're learning about transmission of the disease has evolved, and the challenges is having legislation as well as public knowledge keep up with that rapidly changing understanding of how the virus has transmitted. And some of the, indoor situations are just so challenging no matter what. I see one of them is about beds and housing must be physically distant. And of course, the issue of housing and transportation touches ag. And it can be very hard to have oversight. We just have a few more minutes before we go into the second clip of your film. And I want to know what either of you thought, what you would like viewers to do after seeing this film. I'm going to suspect they'll be enraged, concerned, and have a lot of care for this situation. Do you have a wish list of what viewers who may not be working in farm work can do?
Our job is really to tell this, our journalism and our job is to tell you the story. And then, does the story move you? Do you feel something? Do you have a better understanding of what the situation is in your state, in your county after watching the film? Salinas Valley is right next to Carmel and Monterey, beautiful coastal cities, a lot of tourism before the pandemic. But, these are a lot of times the agricultural communities are right there next to, our other cities. You don't always think about the farm worker. And so one of the things we tried to do in the film, in addition to the reporting, the journalism, what you learn about workplace safety, is connect with someone. And so you do get to meet and spend time with Cynthia, and you spend time with her family, and you understand her medical situation, so that she's not, a farm worker whose face is covered and who you drive by. If you ever have seen farm workers picking in the fields, they're anonymous and abstract. And so it was also important for us to have Dr. Cuevas, who you just met, who's in the film, grew up in farm worker housing. His family was a family of farm workers. Assemblymember Rivas comes from a family of farm workers. He also grew up in farm worker housing. So that insight, that perspective, was important for us to have in the film, people who were connected to the story in that way. And so I think for us, it's like, the response we got from a lot of viewers is, what can I do? And I think that's where, our job is sort of to say, if the story moved you enough to ask that question, then our job is, that's our job is does it move you to want to do something, or ask more questions, or want to know more? And I think that's where, people were asking about donating. There, of course, the clinic and other, there are always food banks. There are people, organizations working with directly with the communities that you can donate to. And I think one of the larger questions that still looms, and I think this is where people and their representatives, I mean, they can reach out directly, but we still have this elephant in the room, which is your immigration status. And, farmers will say that they need this workforce. They rely on this workforce. They don't want this workforce to go away. And so you have the tension of needing to maintain a workforce, but also insisting that it not have legal work status. And so I think that's the larger issue that makes for all of these smaller problems. Even you're going to work sick and being afraid to report that you don't feel well is tied to being afraid. That's what the doctor was saying in that clip. It's tied to the fear of being deported. Mm-hmm. So it's all connected, and it has to do with this larger issue of keeping so many hundreds of thousands of these workers in this, status that doesn't allow them to assert themselves as workers with rights in this country, even though they have rights. And even though that's made clear to them by unions and, people who work directly with workers, there's still a tremendous fear. So I think thinking about the larger issue of the status of so many essential workers is something that, people can then motivate people to reach out directly to their elected officials and see, whether that's going to change, because we've been talking about it changing for so long.
Such a great point, that if anyone eats in the United States, you're connected to immigration policy. And just if I can repeat back your point, that we may not know what to do, but we all have state and federal elected officials that we can contact. So, and we're going to hear more about that in the next period. So thank you so much. And I hope we'll have a chance to bring you and Andres back, or if other people have questions, but let's move on now to the second part of the clip. Thank you so much, Daffodil and
Thank
Andres.
You.
Is closing down meat packing facilities across the country.
At least 22 meat processing plants already shut down in this country.
We heard about a growing outbreak a few hours from Salinas, at one of the biggest meat processors in the U.S.
The Central Valley Meat Company in Hanford, that's about 30 miles.
Central Valley Meat employs around 700 people at its plant in Kings County. The company has a history of violating health and safety codes and has been cited for animal abuses, as seen in this undercover footage. In the last decade, it's had 2 beef recalls and been shut down 3 times. When the virus appeared at the plant in April, workers told us that at first the company did nothing to protect them.
When it started, they denied everything. There was people getting suspended for showing up with a face mask. A couple of people were actually coughing, and they wore the mask just because they were coughing, and they got sent home. They used the phrase, "You're scaring the employees, your co-workers."
Management will say that it's just rumors that someone had posted on social media.
A lot of people started missing, and then they started calling them and threatening them about their jobs. If they didn't show up back to work, they would be getting fired.
These 2 employees spoke to us on the condition that we not disclose their identities because they were afraid of losing their jobs.
In the Central Valley, at least 138 employees tested positive for COVID-19 at a meat.
They said it wasn't until the outbreak made the local news that the company began to implement safety measures.
After everything came out on the news, everybody's like kind of panicking.
After the outbreak, they started separating us in different tables apart. And then they were providing us with face masks because most of us were complaining. We were like, we need to protect ourselves.
According to the workers, more people kept showing up sick every day.
People were going in sick, fever, throwing up, coughing. They ask you at the gate, do you have any of these symptoms? You tell them yes, okay, you can go right down and go ahead and work. It's like, shouldn't I go home? No, just go ahead and go to work.
They worked inside a plant they say looked similar to this one, and that even as the virus spread, the pressure to keep up production continued.
We still see people who had came back who are coughing and sneezing. They don't even cover their mouths because, they're moving constantly because the line's, running fast. And some of them, when they sneeze, the paper towels are kind of far away from them. So some of them, they just wipe it off on their face mask or on their smock.
Central Valley Meat declined our repeated requests to discuss the outbreak, but the company has publicly denied threatening to fire workers or punishing them for being out sick. In late April, the company sent a note to employees comparing the outbreak to a normal flu season and saying that the coronavirus is not some cloud floating around waiting to infect someone, and assured employees that nightly cleaning was killing any potential virus residue.
Early on in the pandemic outbreak inside plants, it was chaos, it was fear, it was anxiety.
I reached out to union leader Mark Lauritsen, who'd been monitoring outbreaks in plants around the country.
Nobody knew exactly what they were dealing with. And that just led to, if you were a worker in a meatpacking plant looking for answers, those answers were hard to come by early on in this pandemic.
So how big is this problem?
Just in meatpacking alone in the United States, over 14,000 of our members have been exposed or contracted COVID-19 because of their proximity to work. 14,000 people. And those are just our members. So you have to, if you look across the entire industry, you're probably looking at a number that's substantially higher than that. And when you have 14,000 of our members that are exposed and sick, that's a tremendous stress on the efficiency of the whole food supply chain in this country. And quite honestly, if we want to protect our food supply chain in this country, let's protect those workers.
In late April, large outbreaks were forcing plants around the country to close down until the president signed an executive order that prompted companies to stay open.
We're going to sign an executive order today, I believe, and that'll solve any liability problems.
When the president said that they weren't going to be closing the meat plants down, everybody got upset because we were just getting ready to close. At least that's what they were telling us.
Both of these Central Valley Meat employees told us that they tested positive for COVID-19.
And we're going to have to stop it there. And as I mentioned already, we do have the film is on PBS Frontline to watch the entire thing. So I hope everyone will get onto that right after this. I want to now move our program from understanding to action and pass it over to our featured guest, Noe Paramo, who is the legislative advocate for California Rural Legal Assistance Foundation, and the Honorable Robert Rivas, Assembly member from Assembly District 30 and the new chair of the State Assembly Agriculture Committee. Thank you so much for being with us. And I'll step away, please.
Thank you, Nina. Assembly member, a privilege to be here with you today. And
likewise, yeah, I really appreciate the invitation. It's great to see you.
I appreciate Daffodil Altan and Andres Dediel and the film they're doing. We have something in common, Assembly member. We're both from immigrant families, farm worker families. I grew up in Tulare County, which is right next door to Kings County, where we saw that portion of the clip. It was referenced that you also appeared and were interviewed for the film. And what did you learn from that experience being in the film?
Well, first, it's great to be a part of this this panel and this discussion. It was really a critical time when this film was made. I really appreciate the work, that was done by Andres and Daffodil, because, in my opinion, as a new member of the legislature, I was elected in 2018. I've always felt that good public policy needs to be driven by data. And I think what we heard in the previous panel, trying to address the challenges of COVID-19, the impacts that they were having in, amongst farm workers and our communities was very challenging because we didn't have that data. We heard rumors of these outbreaks that were occurring in Imperial County and in the Central Valley and the Salinas Valley. We had these guidelines that were being applied very differently from region to region, from employer to employer. But was really critical, was really important about this work, about this documentary, was the conversations that were had with farm workers who had the opportunity to show America their struggles, who had the opportunity to talk about the challenges that they experienced every single day as a part of their lives, whether it was at home, whether it was on the job, and having that information, having that testimony meant everything, because it gave us a glimpse into the challenges and struggles that they were having, and then how we as legislators could respond by trying to create these pathways to minimize the challenges that they faced on the job, at home, to try to minimize outbreak and the impacts of COVID-19.
And as you said, as a legislator, and then taking these stories, and we know that this has been impacting our communities, and the pandemic has just exacerbated that situation. And as your work in the legislature proceeded, what safeguards and protections did you see your work needed to be done, and what did you do to author some of the policies that would address some of the gaps in the stories that the farm workers are being faced in the documentary?
Sure, and that's a great question. You know, at the onset of this pandemic, understanding the potential impacts that farm workers were going to experience, having just come off of my first year in the legislature, having championed a farm worker housing act, because the housing crisis in California, certainly is exacerbated for farm workers, low wage earners. It's a humanitarian crisis, critical overcrowding. So understanding all of our medical doctors were advising social distancing, which is nearly impossible for farm workers who live in these overcrowded areas, who travel in carpools to and from job sites, who work in overcrowded work sites at times. A lot of times they don't have access to hand washing stations or bathrooms in the fields. And so all that stuff that I already knew, the fact that I was raised by immigrant farm workers, I grew up in these same conditions in farm worker housing. I quickly shifted my focus on trying to legislate solutions to minimize the impact of these outcomes. And so what we did is I introduced this first in the nation COVID-19 farm worker relief package. The marquee bill of that package was Assembly Bill 2043. It was an urgency ordinance that was signed by the governor, passed overwhelmingly in the legislature. And what our legislation did is it did two things. First, it ensured enforcement of Cal OSHA of its COVID-19 guidance by funding a targeted bilingual outreach campaign to educate our agricultural workers, our farm workers, on Cal OSHA guidance. Education was a significant step to educating the workforce on how they could protect themselves, protect their family members, but also, as we found, farm workers will, if they understand the rules, understand these precautions, they will hold their coworkers accountable as well. On top of that, though, this targeted educational campaign also includes workers understanding their rights, understanding the benefits they're eligible for in the way of sick leave, in the way of workers' compensation. The second part of that bill, which was critical, was directing Cal OSHA to track and report workplace investigations. So that way we as legislators, as policymakers, have that incredibly important information, so that way we can address gaps and issues that are being reported, that are being investigated. Other legislation that I was happy to work on was a companion bill to our bill was done by my colleague, Assemblywoman Aloise Reyes, which was Assembly Bill 685, which did two things. It mandated a 24-hour noticing requirement to any worker exposed to COVID-19. And then the second part was mandating reporting critical information related to COVID-19 to appropriate state agencies. So that way, again, we're being transparent. We have the data to make sure that we are making informed policy based on this data to solve these problems moving forward. But clearly, a lot of the work we did, these bills, but also advocacy. Advocacy was huge. Advocating the concerns we were seeing on the ground related to testing, the gaps in ensuring that farm workers were prioritized to get tested for COVID-19. The fact that we were advocating from day one in March to provide temporary housing to our farm workers, understanding the critical overcrowding conditions that they experience. And so because of our advocacy, the governor did take action in creating what was called the Housing for Harvest program in July to provide that temporary housing for our farm workers that became infected. But certainly a lot more work needs to be done to ensure that farm workers have the necessary PPE, because we could talk about the impacts COVID-19 has had on farm workers in our communities, but it's also, this is a year where we face historic wildfires. When everyone was scrambling to get PPE and face coverings because of COVID-19, farm workers were laboring in the field in the most toxic air quality conditions without the appropriate face coverings. Because as low-wage earners, as we experience, and as we found out from this documentary, farm workers either show up to work or they don't get paid. And as low-wage earners, more often than not, they show up to work, and that's why we're seeing that COVID-19 has had such a dramatic impact on farm workers and their families.
Thank you, Assemblyman. So these are some the critical pieces that were championed. We appreciate your work on that, and the legislature and the governor as well. And so the bills and the regulations, the programs that are being administered to help farm workers. So that's happening now, and which we learned needed to be done as a result of the film. Now, where do you see the gaps? Where do we see going into the next legislative session, the 2021 session, as it's about to kick off this month, and your work in the Capitol? Where do you see that going?
Well, the work has been ongoing, and certainly we have a lot more work to do. There are a lot of gaps. I think it was mentioned in the first panel. The challenges facing our farm workers, the reason why they're such a vulnerable group of workers and such a vulnerable population, probably the most vulnerable population of workers in our state and around the country, because a lot of them are undocumented. In the last 4 years, they've had to live in the shadows because of all of the hateful rhetoric coming from Washington and the Trump administration. And so here we are in this situation. They're doing essential work, ensuring that we don't have a disruption to our food supply. And, they play such an essential role to ensuring food security, not only in our state, but in our country. But so much in the way of support that we need to ensure that they have access to, because COVID-19 certainly has exacerbated a lot of these challenges related to assistance for our farm workers and their families as low-wage earners, for our undocumented residents. We could talk about housing, the critical overcrowded housing, these conditions that they live in, that their families live in. Student homelessness is rising. The rate of student homelessness is rising. But certainly areas that we need to focus on is undocumented residents. A lot of them pay taxes, and they pay a lot in taxes to our state, but they are not eligible for the benefits that all of us can access should we lose a job. So ensuring that they have a lifeline in the way of a direct stimulus payment. I know that our governor here in the state, Mr. Newsom, and his administration prioritized some money that went directly to our undocumented residents, but certainly wasn't enough. We need to do more to ensure that they're supported. So certainly there's going to be efforts to ensure that we are supporting our farm workers when it comes to having a moratorium on evictions and water shutoffs. We certainly have to do more in the way of broadband to ensure that students, that children of farm workers have access to broadband, have access to the equipment, so that way they can actively be participating in these virtual classrooms that are occurring across the state as students are not in the classroom. So certainly there's a lot more work that we need to do that is that we will focus on in the legislature. I know that we are actively engaging with around PPE, around ensuring that as we anticipate another wildfire season this year, that farm workers have access to the appropriate PPE, so that way we can do everything we can to ensure that their health and wellness on the job, but certainly continuing to monitoring the data now that we're getting more reporting, more data about the impacts COVID-19 is having on our farm workers, using that data to you certainly legislate good policy to ensure that we're minimizing health impacts for our farm workers, minimizing outbreaks in these very vulnerable areas of the state.
Thank you. And as you mentioned, these other services, because our farm workers are in the communities, rural, isolated areas, and then are mixed status families. So some aren't documented. The most percentage of the farm workers are undocumented, 60+%. We also have cultural and linguistic issues. Our indigenous farm workers speak languages other than the Spanish, so like Triqui and Zapotec and Mixtec. So there's the challenges in providing information there. But the one critical thing you talked about, the immigration status, and our families are not just the inherently dangerous farm work, but in the community and living, they need this support, these wraparound services, and just the mix of programs. So if you're undocumented, you're ineligible for unemployment. You're ineligible for food stamps, the cash assistance, sick leave, you would be eligible. And in those areas, it's critical to get information to our farm workers. How do you see the outreach and education being done in the future to address these different types of programs? You're addressing housing and housing for harvest and the rapid testing that's needed.
Right. So, I think you bring up a very, very important point, and that is the undocumented status, and I think what I have seen, the incredible work being done in the Salinas Valley by my friend, Dr. Max Cuevas, the work he does is only possible because of the relationships he's been able to build and establish, he and his staff. And I think that is critical. That is absolutely key, is building trust within our farm worker, families, within this very vulnerable population. Once we establish that trust, then we can do more in the way of ensuring that they're provided the services that they need, whether it's related to healthcare, whether it's related to direct economic support, whether it's food assistance. Certainly ensuring that we build that trust is best done at the local level. That's why it's ensuring that, one, we're educating these farm workers, but it's all about outreach, and that, in my opinion, is done by working with these local organizations, these local healthcare groups who have worked for decades and for years with these very vulnerable population of workers and families. Then it's working through them that it'll certainly go a long way to support our farm workers and their families.
Thank you. Well, this week has been a historic week. We heard in the news, the vaccines arrived in California, and now our frontline healthcare workers are prioritized to be accessing that. What are the possibilities and that you see that farm workers will expect access to the vaccination, since they are essential workers? They're front of the food supply chain. And what do you see the vaccination process in helping our farm workers and their families get vaccinated? Right.
Well, what we know is certainly healthcare workers have been at the front lines, but so have farm workers. From day one of this pandemic, the work that they do is essential. It has always been essential. And so certainly, we, myself, my colleagues in the legislature, the Latino caucus, we have advocated. We sent a letter, I want to say, on December 4th to the governor, advocating our concern and requesting that farm workers and food, all food service workers be given the priority of a vaccination based on our state here in California, based on our rollout. We asked that priority be given to farm workers in phase 1B of the vaccine rollout. And, for all the reasons we've already talked about, how essential they are to food security, to ensuring that there's not a disruption in food supply here in our state and in our country. It is absolutely essential that farm workers be given the priority to receive this vaccination. But as we just stated, having this level of trust within, within our rural areas for farm workers and their families is going to be very, very important, because if we're given priority, if we have access to the vaccination for farm workers, that's the first step. But certainly, making, ensuring that farm workers want to receive the vaccine. That's going to require a lot of outreach. It's going to require a lot of education. It's going to require a lot of work. And that's where I think people like Dr. Max Cuevas come in, our local nonprofits, establishing those partnerships to ensure that we're educating, that we're communicating, working with farm workers. Because when you look at a recent study that was done by UC Berkeley, it should be a concern to all of us. A large percentage of farm workers don't want to take the vaccine. So it's our responsibility to educate them on the importance of receiving this vaccine for their own health, for their own safety. And so certainly for us, as a state, to ensure that agriculture, that, if there's this expectation that we're going to, ensure that there's not going to be a disruption to our food supply, we need to ensure that agriculture has access to a very healthy workforce. And so ensuring that this vaccination is rolled out appropriately, strategically, is going to require a lot of work.
Thank you, Councilman. You laid out a plan, steps that we need to take. Still a lot of work and challenge ahead. As an advocate, as one of the advocacy groups, working with other farm worker advocacy groups, what can we do to help you? And with that, as our viewers are on here, what can they do to also help you and help farm workers? That would be my closing.
Well, yeah, as I mentioned, a lot more work needs to be done. There's such a significant need, for our farm workers, for their families. It's absolutely unacceptable that, in the district I represent in the Salinas Valley, student homelessness is sky high. I grew up in farm worker housing. I was raised by immigrant farm workers. We had it tough, but I didn't have it nearly as tough as these families, these children have it right now. And so certainly they need support. And the best thing viewers can do is work with local organizations that support farm workers. Contact your legislators for assistance. You're always welcome to call our office. We have a whole bunch of network of organizations that can use your help and support. I know that we coordinated one successful farm worker relief drive, which ended up being 5 or 6 relief drives because the response was so overwhelming, because the need is so great. And so there's always room. There's always such a need to volunteer and to give back. And so certainly farm workers, their families, they need help. And so anything that you can give, anything that you can help, any time you can volunteer is always appreciated and very much needed.
Thank you so much for that, Assemblyman, and thank you, Noah. On the last point about how people can give and support, I'm so appreciative, Daffodil, that one of the filmmakers put a list, and we shared it in the chat of this meeting, of local organizations on the ground to whom you can donate funds, time, PPE, whatever you can do. I also wanted to call attention, if it's unfortunate we're just coming on the end of time, we have more questions and so many people want to continue the discussion. Let's continue it on social media and bring more of this important information over there. We have Assemblyman Robert Rivas on Twitter, also Daffodil Altan, Andres Cediel, and California Rural Legal Assistance is at CRLA Foundation on Twitter. I just really want to thank all of our panelists. I want to thank PBS Frontline, the UC Berkeley School of Journalism, the California Latino Caucus, who supported Assemblyman Rivas's participation. And from all of us at the Berkeley Food Institute and UC Berkeley, thank you so much. We really appreciate everyone coming, and have a safe and healthy holiday season. Thank you, Noah.
Thank you.
Thank you.
It's been an honor. Thank you.
Thank you, Daffodil. Thank you, Andres.
Thank you for having us.
Take care.
Assemblyman, it's been an honor and a privilege. Thank you very much.
Thank you, Noe.
Good to see you, Assemblymember Rivas.
You can see more of him